What does synovitis feel like? Imagine feeling a constant ache in your joint that can suddenly turn sharp and intense. That's often how synovitis, or inflammation of the joint lining, presents itself. When your synovium becomes inflamed, it can cause the joint to feel tender and warm to touch, almost like it's slightly overheated. You might notice swelling that looks puffed up or feels soft and spongy when you press on it. Sometimes, the skin over the joint turns red or feels warmer than usual, signaling active inflammation. Stiffness is another common symptom, especially after resting or waking up in the morning. Moving the joint might feel stiff or limited, making everyday tasks harder. The pain can fluctuate, coming and going, or it might stay persistent if the underlying cause is a condition like rheumatoid arthritis. If the synovitis is due to overuse or injury, the discomfort often stays localized to one joint and improves with rest. But with autoimmune forms of arthritis, multiple joints can be affected at the same time, and the symptoms tend to be more persistent. The pain associated with synovitis can be dull and achy, but it can also become sharp, especially during movement or activity. You might notice that even gentle motions, like bending or straightening your finger or knee, cause discomfort. Swelling and warmth are signs that the inflammation is active, and these symptoms can sometimes be visible or felt when you touch the joint. In some cases, the swelling might feel like a soft balloon around the joint, and you may notice a feeling of looseness or instability. The combination of pain, swelling, warmth, and stiffness can make it difficult to perform simple actions like opening jars, walking, or typing. Managing these symptoms often involves resting the joint, taking anti-inflammatory medications, or applying ice to reduce swelling. Understanding how synovitis feels can help you recognize early signs of joint inflammation. If you notice persistent joint pain, swelling, warmth, or stiffness, it's important to see a healthcare provider. They can determine if synovitis is the cause and suggest appropriate treatments to prevent further joint damage. Remember, early intervention can make a big difference in keeping your joints healthy and pain-free.